would like to introduce you to Ms. Shamika Brooks, APRN. She's a family nurse practitioner and has certification by the American Academy of HIV Medicine as an HIV specialist. She's been a registered nurse for 12 years and a nurse practitioner for over 5 years. The county clinic in which she works provides primary care and specialty care to those living with HIV. She also rotates on the inpatient HIV consult service 2 weeks out of every month. The clinic she works in is fairly large, as they saw over 5,000 patients last year as a department. There are about 15 physicians and 9 advanced practice providers. The county hospital in which she works has a closed network system, and her clinic has access to all specialty services available within the system. I want to take the time to thank you so much for taking the time to meet with me. And I wanted to ask, is there anything that you wanted to add to your introduction?
Yeah, so I also have an continuing education company online that provides education and training for advanced practice providers in the area of infectious disease. It's kind of like a specialty, and I found a passion in that, so I love to educate. So that company is available. And then I also have a clinic that I'm starting on the side, which is a primary care clinic and Cure Health Clinic in Dallas, Texas. And I'm in the beginning stages of trying to build up my patient panel with that. So I'm a very busy person.
I see. That sounds so exciting. So I know your time is very valuable. So again, I want to thank you so much for taking this time with me.
Thank you.
So if you can think back to when you first started practicing as an NP, what was 1 or 2 of the biggest struggles you faced as you transitioned from an RN to an NP?
One of the obvious struggles I had was just confidence in my practice. You know, schools only prepare you for the minimum. But when I got out there, I realized there was so much more that I needed to learn by way of experience. Because you can memorize and practice guidelines all day and follow them to the letter. But what do you do when the patient is not fitting the characteristic presentation? Experience lends to more nuanced thinking and allows you to truly become creative in your advanced practice of nursing. And within that confidence issue, there's the imposter syndrome. Working at a large county hospital that is associated with a medical school, I somewhat would feel inferior initially because I'm sitting there, licensed already, but I'm alongside residents and physician assistant students. And so it was a difficult thing to adjust to. But however, it allowed me to realize over time that physicians and other healthcare providers have their own maturation process to competency. So overall, afterwards, I started to feel more confident in my practice because I was able to, not only precept nursing or nurse practitioner students, now I can precept residents or, PA students as well. And one thing that I didn't realize would be another struggle in practice was the language. I've been in healthcare for over 10 years and familiar with medical terminology, but to me, it seemed like the practice of medicine had its own structured system of communication. So on top of all of the issues, with confidence and everything else, this kind of just compounded the situation. It was a huge learning curve from going from a registered nurse, which I view in my mind as the one who takes action and implements the orders by the physician. And I had to switch hats and become the scientist. So basically evaluating hypothesis, and then looking at the data that is available to provide the best care. And I'll give you an example because some people may be like, okay, what is she talking about with language? When it comes to a differential, I really would work up a patient and I had a pretty good idea of what their diagnosis may be. And I would be tunnel vision and set on that one diagnosis. But what I learned, working with the medical school and the faculty that's there is that it's not always 100%. You want to be suspicious of a particular disease or illness, but there's always another possibility that something else could be, the cause. So my documentation changed and my mindset changed around that. So I don't know if that kind of makes it clear about the language and the way they present patients and everything to their faculty members.
Oh yeah, definitely. Definitely. So when you consider your scope of practice and the regulatory bodies within your state, do you agree with the regulations of your licensure designed by the state? And are there any changes that you think that you would make to the credentialing privileges?
So in Texas, it's pretty strict. We are under delegation and supervision by a physician to practice. I
Okay.
don't necessarily agree with the medical board having dominion over our practice and having the authority to dictate how we practice. I do believe that there should be a framework in place for advanced practice providers to obtain full practice authority, in their state after meeting certain requirements. I know, coming out of school, I don't think I was ready as of yet. I needed to get some experience before I felt confident in my practice to practice alone. So those are some of the thoughts that I have. I do feel like the tide is going to change because of the value that NPs have showed during this crisis with the COVID-19. So I'm hoping that a lot of the barriers to practice will eventually be eradicated and allow us to practice at the top of our licensing skill.
So do you consider yourself working in a collaborative practice? And how often would you say you collaborate with other professionals?
So my workplace, like I said, is pretty large. We have 15 physicians and 9 advanced practice providers. So I'm constantly collaborating with other healthcare professionals all day, every day. So that's not a big issue. So I do view myself as someone who's very collaborative. It's difficult in healthcare to view yourself as an island. You don't know everything, different guidelines change. And so everybody has their own unique way that they practice. So I kind of like to gauge and get other people's opinions sometimes if I'm not quite sure. One example I will tell you that was successful with collaboration was I had a patient with a positive urine culture for a resistant organism, which is ESBL, that I was talking to on the phone and doing their virtual office visit. So since this organism was resistant, there's limited oral treatment options, and the person had already been on an oral treatment option that looked like it was going to work based on the data that we had. So after that wasn't working, my initial thought was, okay, I might have to have this patient admitted just for IV antibiotics to treat this urinary tract infection. So I consulted with one of our ID physicians and was made aware of another oral option that was not listed on the report when we got the urine culture. And this was an option that we could try to save the patient a possible admission for the hospital. So like I said, I think health collaboration is very important, and I'm grateful to be in a setting where I have access, to different physicians and other healthcare professionals.
So besides collaboration, what are some methods you use to reduce stressors that you face as an NP?
So one thing that I was not doing when I was a registered nurse was taking very good care of myself. I was taking care of all my patients, working the 12-hour shifts, and I wasn't taking very good care of myself even in grad school. But when I transitioned to the traditional Monday through Friday, 8 to 5, I had time to sit back after school was over and really realize how much my mental health and self-care should come first. Because it can lead to early burnout. And because of the patients I work with, a lot of them have so many issues outside of their health, and it can become draining. So what I do now is it's mandatory that I take time out for myself, for my mental health. I have a therapist that I talk to regularly. I make sure to go and do things that make me feel good. So I put myself first because I want to be the example to my patients that they should do the same as well. One other thing that I learned early on is that as a new grad NP, I basically was identifying with every sob story that my patients gave me. I mean, being moved to tears on every visit was a little draining. It was a little draining. So I was allowing myself to be enmeshed in their emotions and everything that's going on in their lives, and it was making me, burn out. And so, and then the funny thing is, I would have exhausted all this emotional energy to try to come up with a problem and help them solve something. And then they agree to it and come back and they've done the same thing. Like we had no conversation. So I was like, okay, you know what? I'm only going to extend myself so much to show enough compassion to let them know, that I care about them. But at the same time, I'm not going to want more for them than what they want for themselves. and I'm not going to, you know, basically enmesh myself in in all of their problems. So that was something that I had to learn, and working with a therapist, it really helped me to deal with that.
Good. So, I mean, you talked about self-care, working with a therapist. Do you have any other tips for new to practice NPs to help alleviate stressors?
I know it's hard for them to realize that, you know, it's going to take some time for them to develop their confidence level in their practice. So
Mhm.
they're going to be stressed all the time, you know, worrying at night if what they've done is going to harm a patient or if they did the right treatment or the right thing. So I would say it might be good to get a mentor, like an older nurse practitioner or someone who's been practicing longer
Mhm.
than you, that you can trust and you can kind
Excellent.
of vent to and talk about ways in which you can, you know, alleviate stress. So I think just talking about it is great, because I know I felt like that a lot. But I had an older nurse practitioner who had been practicing longer than me, and she was giving me advice and letting me know that it's okay. We all make mistakes. And then me working at the county hospital, physicians make mistakes. All healthcare providers make mistakes. So seeing that we're all human, and that, you know, don't beat up on yourself if you do make a mistake. Just learn from it and own up to it and move on.
So I am very, very big for patient advocacy. So I'm interested to know, um, can you describe a time where you had to advocate for a patient to receive the proper care? Do you feel like they were eventually successful in getting what they needed, and how so?
Yes, I have a perfect example of that. I want to say about 3 weeks ago, we were doing the virtual office visits from home. And so I called this patient, and she's been oxygen dependent for over a decade. And her insurance suddenly was out of network with her oxygen supplier. So they told the patient in April, mind you, this is the COVID-19, a lot of things are slowed down. They told her in the beginning of April that she needed to find another company. And so she had 30 days. So I'm talking to her. This is towards the end of, or the beginning of May when I'm talking to her. And so there was another company, but they wanted all this documentation, her O2 saturation test, all of that before they would send out the oxygen. So the poor
Okay.
lady was in tears. She's on a high amount of oxygen, like 4 or 5 liters nasal cannula, like constantly. And so the poor woman was in tears. She didn't know what to do. So I basically, you know, had to put on my advocate hat. I used to be a case manager, so I know how the DME process works. So I called
Okay.
the new company and, you know, tried to get the information from them and find out as to, you know, could there be something that they could do to kind of waive this requirement in the midst of this pandemic so this patient can get her oxygen to prevent her from going to the hospital with a bad outcome. And they were
Mhm.
like, well, there's nothing we can do. She needs to bring the new oxygen and, you know, all this other stuff. So they sent me around and around. So I finally called her other company and let them know the situation. I'm like,
Yeah.
look, we're in the midst of a pandemic. This patient is oxygen dependent. She's not able to get this information to this other company at the moment. So her prior company agreed to give her a 2-week oxygen supply while a company that would come out and do her oxygen saturation test so the new company could have the information. The patient was so grateful. She was in tears that I was able to help her out to where she was able to
Mhm.
get her supply of oxygen and then, you know, be able to transition over to the new company. So it kind of just I was just a little sad because not all patients or not all people in the United States have someone that can advocate for them like that. And
Yeah.
I knew the language to use in order for them, for their ears to perk up as far as liability is concerned, in order to get what she needed. And she was very grateful for that.
Yeah. Oh my gosh. I love that story. I love, love, love positive stories. So I'm going to end this interview on a positive note. Again, I just want to thank you so much for your time. You have imparted a lot of knowledge and wisdom on myself, I'm sure, as well as my other classmates that will view this recording. Thank you so much again. And I will talk to you soon.
Okay, thank you. Have a great day.
All right. Bye bye.
Bye.